Now to that other vaccine story we told you about that you will only find here on NewsNation tonight. Hospitals across the country fine-tuning right now how exactly they will quickly and safely vaccinate thousands of their healthcare workers. Let's go now to NewsNation correspondent Marky Martin. She is live in Dallas tonight with that part of our coverage. Marky.
Rob, it is quite possible that we are just days away at this point from seeing certain Americans receiving that very first round of the COVID vaccine, especially in the wake of yesterday when you had that FDA advisory panel formally recommending that the FDA does authorize the Pfizer vaccine. And leading up to this debut day, you have hospitals, healthcare workers practicing just to be prepared for day one.
We really want to treat this vaccine as the liquid gold that it is. It's really the only tool that we have right now in our toolbox to cure this disease.
It's the countdown to a treatment that's been ticking for months. Americans eager to know when the first COVID-19 vaccine would roll out, despite the uncertainty of when that day may come. Hospitals have been practicing anyway for its impending distribution.
Not a lot of people have vaccinated for a large pandemic like this. The last time we've done anything like this was during H1N1. So we want to make certain that we get it right.
Frontline workers inside New York hospitals experimenting with best practices, from delivery and circulation to timing and storage.
We are working to set everything up so that we're ready to go as soon as the local and federal authorities give us the go-ahead.
Refrigeration is vital. These sub-zero units needing to be about 80 degrees below zero to effectively store the vaccine. Hospitals conducting 11th hour checks to make sure their freezers are in working order.
We get it here in the pharmacy. We have to empty the box within 90 seconds and open the freezer. The freezer is a sub-zero freezer.
Some states like Arizona simulating what the drive-through process will look like when patients are able to receive the vaccine. In Texas, the governor says his hospitals and clinics are ready, waiting on standby for their shipments.
We have more than 7,200 providers already lined up across the entire state of Texas that are waiting just to receive these vaccines.
For those on the front lines, every day of rehearsal counts, because when V-Day comes, mistakes will be costly.
If something goes wrong, it's not an easy replace. Other times, we've had freezers or refrigerators that don't work. We can replace the drug. In this case, we can't.
And of course, our healthcare heroes and nursing home residents will be among the first to receive the COVID vaccine. And a lot of the frontline workers that we talked to said they will keep on doing these dry runs, these rehearsals, until it is time to switch to offense. Coming up tonight at 9 o'clock Central, I take you behind the scenes of even more hospitals. And I also talked to a Texas doctor. He is scheduled to get his first COVID shot next week on December 14th. How he's feeling about it and what he has to say to Americans. Reporting live in Dallas tonight, Marky Martin, NewsNation.